So let me briefly introduction myself. So this is Takuya Haraguchi. So I'm from the Sapporo Heart Center. Atherectomy devices have a relatively high rate of complications, such as vessel perforation and distal embolization. Our fracking technique is to modify deep calcium with hydraulic pressure through an 18-gauge needle puncturing calcified plaque to crack calcification. This technique cracks calcification in deep side, so it achieves greater acute luminal gain, increased vessel compliance, and restore vessel mobility, serving as a new vascular treatment option for patients. In a similar fashion, intravascular lithotripsy uses pulsatile sonic pressure waves to modify calcified regions from the intima to the medial area. The objective of our fracking technique and that of lithotripsy is similar, but the way of approach is different because lithotripsy is from intravascular, but ours is from extravascular. And the fracking technique modifies deep calcification from the outer to the middle area of calcification with the advantage of manual control over damage to the surrounding tissues. So we propose a novel calcified plaque modification technique named the fracking technique. The term fracking refers to how a rock is fractured by the high hydraulic pressure. As you know, fracking method is one of the processes of shale oil extraction. Our fracking technique is the application of fracking method to medical treatment. In this technique, deep calcifications are cracked with hydraulic pressure via balloon indeflator through an 18-gauge needle, which punctures calcification to achieve greater acute luminal gain. The important things to tell you is that we have learned the hydraulic pressure can modify not only shale layer, but also calcified plaque in our body, and larger lumen area may be obtained much more than the conventional balloon angioplasty. The fracking technique might have the potential to yield a larger luminal area. Notably, in our cases in our paper, these IBUS images demonstrated a larger luminal area was achieved without changing the superficial shape of the calcification. And this phenomenon implies that the fracking technique mainly fractures the deep calcification. Therefore, we assume the lower probability of distal embolization. Accordingly, distal protection device might not be mandatory. The approach to deep calcification would become the common concept to treat calcified plaque as well as superficial calcification. So basically, larger luminal area after intervention or surgical treatment provides the better clinical outcomes. Fracking technique would definitely improve the better clinical outcomes, patency and freedom from GL, from getting much larger luminal area than balloon angioplasty. Most importantly, it is very inexpensive because it doesn't require any special devices. We use only a needle, contrast media, and saline. Please read our paper for detailed description of the technique.